Mayor Boudreau.
Go ahead.
Sergeant Watson, I applaud the work that you and your team are doing. Yeah, it's hard to put the words together on what that means to this community and the folks that you've helped. In your team's work, with the service providers in the area, are you able to identify gaps in those services? And what does it look like? Do you have regular meetings with these services? They all come together in one room? Give us a little idea of what your interactions with those services look like, and your approach to kind of assessing what it is that we can actually do in the community, and where are our gaps.
Yeah, here's the biggest gap that I encounter, or our team encounters, is a person who has co-occurring, happening at the same time, mental health and drug use going on. And before taking this position, or getting better educated on it, we'd always do this chicken and the egg. Well, which is first? What were they, mental health or drug use? Doesn't matter for where we're sitting to solve the problem. Obviously, it's easier to solve the drugs, stop taking drugs, but it's harder for someone to just say, be mentally well, right? So for services that are in our community, the biggest gap is a person who has those things happening, and we take them to a substance abuse, a rehab center, and say, this person needs help kicking drugs. Well, they have too much of a mental health problem, and they're above our level of care. Back out to the street. Okay, so they need mental health. Go over to the mental health providers. Mental health providers, this person has severe mental health problems. Yeah, but they're on drugs. They need substance abuse. Put them back to the street. And that's where we are bridging the gap, is our BHU people find out which one of those two is easier to stabilize, get the person stabilized so they can get in one of those doors. So that's where the gaps are happening. It's too acute for agency A, so they can't go to the agency B as well.
There's been discussion on a county level on the juvenile center being a possible solution for housing such individuals, where then the individual care providers can come in where they're in a stabilized environment. That's kind of been kicked around as an idea. I'm just curious your thoughts on that, if that would be something that you guys would be behind, if that would help solve the problem.
Absolutely, we would be behind that. So I've tried to work with different groups, other elected officials for probably the past year or so, and we've had several conversations about this very issue. It's probably been even longer than that now. That is a significant gap in our community. When I say community, not just Longview, but Cowlitz County. We need a long-term facility that treats both mental health and substance use, both co-occurring disorders. And it can't be a 30-day inpatient stay facility. Medicaid will only cover a 28-day bed stay. That is not even close to the amount of the time necessary to get someone the help that they need. You can talk to, say, a substance use disorder individual, and they will tell you you're going to look at minimum 60-day stay, if not 90 to 120-day stay. We have none of those facilities in our community.